we're going to focus on, we've talked a lot on this show. We've had some amazing guests like Dr. Zuckerberg who came on to talk about inflammatory markers and the correlation between periodontal disease and a lot of other disease profiles that are now being connected together. And it all seems to come back to inflammation. In fact, I had a patient one time who was an immunologist who was studying a lot of inflammatory markers, and he was very keen on the correlation between inflammatory markers of the body and periodontal disease, and actually was prophylactically treating his own periodontal disease with anti-inflammatory medications to help control his genetic predisposition. So there's been a lot of data on that for a while. Yeah, I think a lot of other areas in our profession and outside of our profession have seen that connection for a bit. Well, a new study came out of London just recently about the Mediterranean diet. This came out of King's College London and was released on the 15th of this month. And they talked about the connection between a pro-Mediterranean diet and its impact and benefit on periodontal disease. Now, Mediterranean diets have been known to reduce inflammatory markers. So if you have a predisposition genetically towards inflammatory disease processes such as periodontal disease, it might be worth noting that Mediterranean diet might be a better long-term plan for you. Now, what does Mediterranean diet mean? Well, it's primarily focused on whole foods, fruit, vegetables, legumes, olive oil as the fat source, with a moderate intake of fish and other protein sources, very limited red meat, although I guess lamb doesn't really count as red meat, right? But they do take in meat, but it's mostly seafood proteins are a primary source of that meat, olive oil as the primary source of fat, and then whole fruits and vegetables, including citrus. So if you happen to currently suffer from periodontal disease or are looking for continual opportunities for patients who have periodontal disease to offer a new suggestion for a lifestyle modification other than brushing and flossing and rinses, maybe Mediterranean diet might be for them. All right, let's get political because after all, this show is going to be a little political. Couple things are coming down that we probably should make note of. First, the ADA did submit some additional comments this week to the DOJ on reviewing some state laws that are impacting competition. Now, the DOJ is reviewing state-specific laws that might be anti-competition laws, might be creating undue monopolies, et cetera. So they have an open comment for different organizations and people and entities to make their concerns known, and the ADA took a position on that. You know, the ADA has a really unique perspective because it can see across all 50 states and how different states have very pro small business and dental laws and other states have very anti dental and anti small business laws. So they can take the compilation of that information to present that to larger groups like the DOJ who are reviewing those different state laws to try to open up commerce, in particular looking at insurance issues, DSOs and their market penetration in different states and how different states recognize them as participating in the marketplace, anti-competition laws or non-compete laws, and how these different safeguards might be in place that are not pro-small business or pro-dental business. So glad to see the ADA stepping up to provide comment. Hopefully, those will be taken into consideration and in review as the DOJ is looking for impact on local economic advancement in different states. Another important deadline for our dental friends out there in the know. We take the CDT code very seriously here at Dentists in the Know. I try to keep you informed, as always, of new changes that have come about, as well as deadlines that might be looming for new changes. If you have a strong, burning passion, desire to want to impact CDT code changes, your deadline for this year to be included in the 2026 review is November 1st. Now, these requests can come from entities, individuals, groups. Dentists in the Know could submit their own CDT code for review and modification. They go through a committee who reviews those. It's a large conglomerate of representatives from different organizations that will then vote to either modify those suggestions or add them wholeheartedly to the CDT code. not to fear if you miss the November 1st deadline. If this is the first time you're learning about the fact that you can, in fact, impact CDT code change, don't worry, you have time. But if you miss the November 1st deadline, your change won't be reviewed until 2027. And as I foresee it, at least for the time being, that will be the way we will be billing as dentists for the foreseeable future. And with that, that's the news.